Hello all. Hospital-acquired infection control. One among the universal standard precautions are biospill management. Today, we are going to present on the topic biospill management.
Biological spill is a fluid which is excreted from or produced by the human body, which includes the blood, urine, feces, saliva, tears, cerebrospinal fluid, peritoneal fluid, pleural fluid, and pus, saliva, and vomit.
Different types of biospill. High risk body fluids, which includes blood, any visibly blood stained fluid or substance, semen, vaginal secretions, amniotic fluid. CSF, pericardial fluid, pleural fluid, and synovial fluid. Coming on to the low risk fluids, saliva, urine, feces, vomit, sweat, and tears. Objectives of biological spill: response, plan outlines, how to assess, respond, and to clean up a biological spill. Spillage of blood and body fluids poses a substantial risk for the transmission of blood-borne pathogens such as hepatitis B, hepatitis C, and HIV. Small, few drops to large volume considered infectious and cleaned at the earliest.
Biospill can be classified on the basis of volume. Less than 10 ml of biospill is called as a small spill, and larger than 10 ml of a biospill is called as a large spill. And it is also classified on the basis of site of spill as primary containment area and outside primary containment area.
Biospill kit. Gloves of 2 pairs, mucous membrane protection for eyes, nose and mouth, goggles with surgical mask, disposable full face shield, fluid resistant disposable aprons or tie back gowns, absorbent materials like newspaper, blotting paper or cloth, waste collection bags, red, yellow, blue or white, water resistant shoe covers, cleaning sharps, small dustbin, small brooms, faucets for cleaning up broken glass, cleaning equipments, bucket, mop, sodium hypochlorite solution.
Confine the biospill area, display no entry sign, wear gloves and other PPE appropriate to task. If it is small volume less than 10 ml, wipe the spill with tissue paper moistened with sodium hypochlorite solution. That is 1% containing 500 ppm. Treat the paper as infected base.
Flood the spill with 10% hypochlorite if it is a large spill greater than 10 ml. While flooding the spill with 10% hypochlorite solution, it is to be ensured that both spill and absorbent material is thoroughly wet. Repeat the steps until all visible soiling is removed. Wipe the area with cloth mop moistened with 1% hypochlorite and allow it to dry. All contaminated items used in the cleanup should be placed in the biohazardous disposal yellow bag. When sharps are involved, use forceps to pick up the sharps and discard these items in puncture-proof container. Should have biohazard symbol.
For cleaning sharp forceps, broom dustpan are needed. Alternatively, chlorine granules can be sprinkled on the spill first, and then the paper should be put over it. And wait for 5 minutes, then removal is done. Carefully remove the PPE in doffing sequence and put it in appropriate biowaste container. Finally, remove the gloves and put it in appropriate biowaste container.
Perform hand wash. Remove the no entry sign after 1 to 2 hours once the aerosols are settled. Report the accident to the Infection Control Committee. Record it as a document. Refill all the components of the kit. Refill all the components of the kit.
Today we had a session in biospill waste management. This is like a training module. We have explained it in 4 stages. What is a biospill? What are the types of biospill? And what does a biospill contains? Then what are the various steps in the biospill waste management? This can be strictly followed and accidental reporting must be done. Future training programs can be established later.